Panic buying was seen in several areas following claims of a countrywide lockdown, and various parties, including the Malwathu Asgari chief prelates, urged President Gotabaya Rajapaksa to enforce lockdown. In a letter dated the 18th of August, the chief prelates of the Malwathu and Asgari sectors requested President Rajapaksa to enforce lockdown for at least 1 week to control the spread of COVID-19 as per recommendations of health experts. Members of 10 political parties also wrote to President Rajapaksa on the 18th of August, calling for a lockdown for at least 3 weeks. They made 7 recommendations that would slow the rapid increase in COVID-19 detections, reduce the number of COVID-19 fatalities and resulting fear among the public, provide some consolation to health workers by reducing the number of patients, and increasing public involvement in the economy. The 7 recommendations are: 1. Taking action against any offices responsible for COVID-19 data discrepancies. 2. Utilizing unused health sector resources to fast-track the vaccination program. 3. Prioritizing persons over the age of 60 and those with various health conditions in the vaccination process. 4. Combining Ayurveda, traditional and Western medicine for COVID-19 treatment by establishing an interconnected medical mission. 5. Establishing people's committees to ensure adherence to health guidelines. 6. Appointing an independent committee of health and economic experts to determine how the country can best face the challenges brought on by the pandemic. 7. Enforcing lockdown for a minimum of 3 weeks. According to the Epidemiology Unit, 44.6% of the country's population over 30 has received both doses of a vaccine. The Epidemiology Unit adds that 373,165 persons have tested positive for COVID-19 to date, and 318,714 persons have recovered from the virus. The highest number of daily COVID-19 detections was recorded on Thursday, with 3,806 persons testing positive for COVID-19. At present, 47,847 persons are under medical or home care. The Information and Communication Technology Agency (ICTA) on Thursday announced a new SMS solution and hotline to manage home quarantined COVID-19 patients in Western Province. The COVID-19 patient is required to send relevant information via a text message to 1904. The information includes the patient's age, national identity card number, and address. The patient must also send the relevant symptom code as well. According to ICTA, the symptom codes are A for patients with breathing difficulties, B for patients with symptoms, C for patients with no symptoms. The format of the information should be presented in as symptom code, age, NIC address. The information will be forwarded by the NOCPCO to medical teams, who will refer the patients requiring medical care to the relevant treatment centers. The patients will be contacted via the 247 hotline to determine their condition. Ambulance services and other medical facilities will be provided to patients, and a medical team will be in constant contact with patients referred for home quarantine through the 1390 hotline. Meanwhile, Sri Lanka Cricket yesterday said 2 games of the ongoing SLC Invitational T20 League scheduled for Friday will take place on Saturday. This was after several employees of the hotel, players and support staff are staying at, tested positive for COVID-19. On Wednesday, the Director General of Health Services confirmed 186 COVID-19 deaths, the highest number of COVID-19 fatalities confirmed in a day.